The lawyer representing the former Holyoke Soldiers Home Superintendent is holding a press conference today trying to clear his client's name.
Attorney William Bennett says the decisions made by his nephew, Bennett Walsh, and the medical staff at the home did not contribute to the spread of COVID-19 that would eventually leave 76 veterans dead.
A Western Mass News reporter, Audrey Russo, was at that conference earlier today and spoke exclusively with family members who lost their veteran loved ones in the outbreak. She joins us now live with more. Audrey.
Attorney Bennett spent much of the press conference explaining that the decision to combine the memory care units at the home and thus COVID positive and negative patients together did not contribute or play a role in the spread of the virus. Attorney William Bennett went on to explain that this was a decision that was criticized in Governor Charlie Baker's independent investigation that was ordered into the home. Attorney Bennett then went on to explain that more pieces of that independent investigation were inaccurate. Attorney William Bennett says his client, former Holyoke Soldiers Home Superintendent Bennett Walsh, did all he could with his medical staff to mitigate the spread of COVID-19 through the halls. He says by the time the two memory care units were combined, it didn't matter because many of the veteran residents were either positive for the virus or already had been exposed. Attorney Bennett says the uncontrollable spread of COVID-19 is evidenced further by the fact that over 40 healthy veterans were sent to Holyoke Medical Center, and only after arriving at the hospital did they get sick.
And all the people that they sent had all tested negative for the virus. They were clean.
We spoke with Laurie Mandeville-Beaudette, whose father was one of the veterans moved to Holyoke Medical Center. She says the virus's long incubation period contradicts Bennett's claim.
William Bennett had made a comment that it takes 4 to 5 days to contract the virus. Well, I'm telling you, within 48 hours, my father had symptoms from leaving the Soldiers Home. So where did he contract the virus? He contracted it at the Soldiers Home.
Attorney Bennett gave the media a packet which contained emails between Bennett Walsh and home officials listing the daily count of personal protective equipment in the home, saying the facility was stocked.
And I think Mr. Walsh is the only person in the United States who put together a plan to make sure there would be adequate PPE, successfully executed that plan, and then was criticized for it.
From the documents provided by Attorney Bennett, which included new shipments, the number of the N95 masks in their supply did not decrease between March 23rd and March 26th, after the first positive patient had been identified. A member of the Massachusetts Nurses Association says that indicates the home did have PPE, but didn't distribute it to staff in that time, something she tells Western Mass News Bennett Walsh admitted to in a meeting.
I asked him specifically more than once in this March 24th meeting, what are you saving these masks and face shields for? And he says that, he's thinking about this in terms of the long term, that he sees this more as a marathon.
Mandeville-Beaudette says she's hurt by the assertion that their experiences weren't considered accurate.
He has no clue what we're going through, the trauma that we live every time we have to think about this or speak about it.
Now, in the listing of PPE that was provided to us by Attorney Bennett, you can see that the isolation mask count and the face shield count was varying in between those two dates of March 23rd and March 26th. However, the N95 masks are largely considered to be more effective in protecting against the virus. In Holyoke, Audrey Russo for Western Mass News.